feeling unusually tired, pale, or short of breath. These could be signs of anemia, a condition that affects millions but often goes unnoticed. In this video, we'll cover the key signs of anemia that you shouldn't ignore, explore the possible causes, and share practical tips on how to manage and treat it. Whether you're concerned about your own health or just want to learn more, stay tuned. You won't want to miss this. Don't forget to like, subscribe, and hit that notification bell so you never miss an update. Anemia is a condition where your body lacks enough healthy red blood cells to deliver adequate oxygen to your tissues. Red blood cells contain hemoglobin, a protein that binds oxygen in the lungs and transports it throughout the body. When hemoglobin levels drop, your body's organs and tissues don't receive the oxygen they need, leading to various symptoms. There are several types of anemia. Iron deficiency anemia is the most common, caused by insufficient iron needed for hemoglobin production. Vitamin deficiency anemia results from a lack of essential vitamins like B12 or folate, which are crucial for red blood cell formation. Chronic disease anemia occurs due to long-term conditions such as kidney disease or cancer, which affect red blood cell production. Additionally, there are also inherited forms of anemia, such as sickle cell anemia, which are passed down through families. Understanding anemia and its types is essential for recognizing symptoms and seeking appropriate treatment. Anemia can be caused by a variety of factors including poor diet, chronic illnesses, or even genetic conditions. Each type and cause requires a different approach to treatment, so understanding what kind you might have is the first step in addressing it. One of the most common symptoms of anemia is fatigue and weakness. People with anemia often feel excessively tired and lack the energy to carry out their daily activities. This happens because their body isn't getting enough oxygen, which is essential for energy production. If you find yourself feeling unusually tired even after a good night's sleep or struggling with tasks that you once found easy, it could be a sign of anemia. Another key symptom is pale or yellowish skin. Anemia can cause your skin to lose its healthy color because of the reduced number of red blood cells. This is often most noticeable on the face, the inner side of the eyelids, and the nails. In some cases, the skin might take on a yellowish tint, which can be mistaken for jaundice but is actually a sign of low red blood cell count. Shortness of breath and dizziness are also common in people with anemia. When your body is low on oxygen, even simple activities like climbing stairs or walking a short distance can leave you feeling out of breath. Dizziness, especially when standing up quickly, can occur because your brain isn't receiving enough oxygen. This can also lead to headaches and difficulties in concentrating, as the lack of oxygen affects your cognitive function. Another symptom to be aware of is cold hands and feet. Poor circulation caused by anemia means that your extremities might not get enough blood flow, leading to a constant feeling of coldness in your hands and feet, even when the environment is warm. This can also cause numbness or tingling in these areas. Finally, some people with anemia might experience cravings for non-nutritive substances, a condition known as pica. This could include cravings for ice, dirt, or starch, and is particularly common in those with iron deficiency anemia. These symptoms can often be subtle at first and might develop gradually, which is why they're sometimes overlooked. However, if you're experiencing any combination of these symptoms, it's important to consult with a healthcare provider to determine if anemia could be the underlying cause. Early diagnosis and treatment can help alleviate these symptoms and prevent complications down the road. Anemia can result from various factors, each contributing to a deficiency in healthy red blood cells or hemoglobin. Understanding these causes is crucial for effective treatment and management. Iron deficiency is the most common cause of anemia. Iron is essential for producing hemoglobin, the component in red blood cells that carries oxygen. When your diet lacks sufficient iron, or if there's ongoing blood loss due to conditions like heavy menstrual periods or gastrointestinal bleeding, your body may not produce enough hemoglobin. Iron deficiency can also be exacerbated by an inability to absorb iron properly, which can occur in conditions like celiac disease. Vitamin deficiencies are another significant cause of anemia. Vitamins such as B12 and folate are vital for red blood cell production. A lack of vitamin B12, which can result from dietary deficiencies, absorption issues, or conditions like pernicious anemia, can lead to megaloblastic anemia, where red blood cells become large and ineffective. Folate deficiency can also cause similar problems with red blood cell formation. Chronic diseases can lead to anemia as well. Conditions such as chronic kidney disease, cancer, or rheumatoid arthritis can interfere with red blood cell production or cause increased destruction of these cells. For example, chronic kidney disease reduces the production of erythropoietin, a hormone that stimulates red blood cell production. Genetic factors contribute to some forms of anemia, such as sickle cell anemia and thalassemia. These inherited conditions affect the structure or production of hemoglobin, leading to the destruction of red blood cells or inefficient oxygen transport. Understanding these risk factors can help you and your healthcare provider take proactive steps to prevent or manage anemia. So, how do you diagnose anemia? It typically involves a few key steps. 1. Blood tests. The primary test is a complete blood count, or CBC, which measures your red blood cells, hemoglobin levels, and more. Low levels can indicate anemia. 2. Medical history and physical exam. Your doctor will review your medical history and conduct a physical exam to check for symptoms like pallor or an enlarged spleen, which can provide clues about anemia. 3. Additional testing. Depending on your symptoms and initial test results, further tests might be needed. These could include tests for vitamin levels, bone marrow exams, or imaging studies to explore underlying causes. Getting a precise diagnosis is crucial for effective treatment. Once diagnosed, treating anemia involves addressing the root cause and managing symptoms. Here's a quick rundown of common treatments. 1. Dietary changes. Increasing your intake of iron-rich foods like red meat, leafy greens, and legumes is crucial for iron deficiency anemia. For vitamin deficiency anemia, include more foods rich in vitamin B12 and folate, such as eggs, dairy products, and fortified cereals. 2. Supplements. Iron supplements are often prescribed for iron deficiency anemia. If vitamin B12 or folate levels are low, your doctor may recommend supplements or injections to boost these nutrients. Always follow your doctor's guidance on dosage and duration. 3. Medications. If anemia is caused by an underlying condition, such as chronic disease or infection, treating that condition is essential. Your doctor might prescribe medications to manage the primary illness and support red blood cell production. 4. Lifestyle adjustments. Maintaining a balanced diet and managing stress can also support your overall health and help your body produce red blood cells more effectively. Regular exercise, adequate sleep, and staying hydrated contribute to overall well-being and can help manage anemia symptoms. For individuals with chronic conditions like kidney disease or inflammatory disorders, managing the underlying illness is key to controlling anemia. By combining dietary adjustments, supplementation, and appropriate medical care, many people can effectively manage their anemia and improve their quality of life. Additionally, if you notice any unusual changes in your body, like pale skin, cold hands, and feet, don't delay in seeking professional advice. Early diagnosis and treatment can prevent complications and improve your overall health. Never try to self-diagnose or treat anemia on your own. A healthcare provider can perform the necessary tests and guide you toward the most effective treatment plan. In conclusion, Recognizing the signs of anemia early and taking steps to address it can make a significant difference in your health. Remember, your health is vital, so don't ignore any symptoms that may indicate anemia. If you suspect you might be anemic, consult a healthcare professional for proper diagnosis and treatment. Stay informed, take care of your body, and prioritize your well-being. If you found this video helpful, be sure to check out our other content on related topics, such as best foods for boosting iron levels. We'd love to hear from you, so feel free to leave a comment with any questions or share your own experiences with anemia. Don't forget to like this video and subscribe to our channel for more health tips and advice. Your support helps us continue to create content that empowers you to live a healthier life. Talk to you soon.